Let's make it
Welcome. Please enter your PIN.
something with
Okay. When you have high blood pressure, you often think about strokes and heart attacks. You usually don't think about how high blood pressure affects your eyes. This is the topic for today's session. High blood pressure can damage the tiny, delicate blood vessels that supply blood to the eyes. This usually results in 3 types of vision problems. The 3 types of problems are blood vessel damage, fluid buildup under the retina, and nerve damage. Damage to the blood vessels in the retina is called retinopathy. This damage to the blood vessels in the light-sensitive tissue at the back of the eye, retina, can lead to bleeding in the eye, blurred vision, and complete vision loss. Having diabetes along with high blood pressure increases the risk of retinopathy. Managing blood pressure is also the only way to treat hypertensive retinopathy. High blood pressure can also cause fluid buildup under the retina. This fluid buildup can cause your vision to change or cause scarring that harms your vision. Blocked blood flow can damage the optic nerve, causing nerve damage. When the optic nerve becomes damaged, it can kill nerve cells in your eyes, which may cause temporary or permanent vision loss. Have you noticed any changes in your vision that you have not discussed with your provider? That's good. Remember, it is important to have regular eye exams. Be sure to schedule an exam and let your care coordinator or provider know if you have any changes to your vision. By working to control your high blood pressure, you will be making changes to prevent or delay damage to your vision.
You have completed your survey.
Well, shoot, I started having to use reading glasses as of last year. And I did notice, and started in 2023, that my vision was blurry to things up close. And I just figured that was attributed to my job. I was a quality auditor, which caused me to be at the computer most of the day. So I attributed to that. Not knowing that high blood pressure was creeping up on me, that there was another issue. So.
Pull cuff up onto your bare arm. Wrap the cuff around your bicep. Be sure the cuff is positioned so that the air hose is positioned down towards your palm on the inside of your arm. Once in place, wrap the Velcro flap around the cuff until it is secure. Be seated and have your arm resting on a flat surface, then press the start button.
Thank you for taking your blood pressure. Your blood pressure is 121/78 with a pulse rate of 73 beats per minute.
Okay, that's beautiful. That spike.
You have completed your session.
That spike in my pressure yesterday.
Hello.
Christy.
What would you like to do? My readings.
That spike in my pressure yesterday, it had to be from that, I put M&Ms in my yogurt. I had Greek yogurt and some M&Ms, and that's what it most definitely had to be. So to go from 120 to 121 one day, because you see it dropped here. It was a good reading here. Spiked up some points here. Can't recall what I had that day. I still haven't started that doggone food log like I'm supposed to, what I'm eating. Don't know what caused it to spike here. I can't recall that. If I think about it long enough, I'll probably come back to me. So here, I yeah, I need to get that food log going because I can't even recall what I ate on this day too. But I know I had zucchini this day, so greens help. And then I had this spike here, and I know from this the day before, I did have some M&Ms in my yogurt. So even just to have the M&Ms on occasion is no good for me anymore. Got to cut that out. Because on yesterday, I had yogurt and granola. So you see the difference. And that's a perfect reading. So just learning what I can and can't have, not even on occasion, because it'll spike that pressure, and I don't want my blood pressure spiked up like that, because that's putting pressure on my heart, and that's meaning that there's more junk back in my arteries. So to be clean artery one day, dirty arteries the next day, clean the next, that's too much up and down. That's too much yo-yoing on my arteries, and I'm not trying to throw my heart into a heart attack. I don't want it to attack me, and I most definitely don't want to have a stroke or aneurysm, any of that, causing a blockage, any of that stuff, that back and forth, up and down. So most definitely that. And I do believe that I'm going to have to go full on raw. Not cooking anything, because this has to get adjusted. So I've already talked to my family before in regards to meals. What they eat, that's their choice. If they want to join in with me, that is fine. But I did share with my family that there are some things that I won't be eating anymore, and it's okay to check me about it if you see me with something and say, are you supposed to have that, or is that good for you, or something like that. I told them, I said, none of that is going to hurt my feelings, because I will, I have a habit. For years I've eaten certain things, and then with life events, some things have changed within my health. So, can't take back, unfortunately, can't take back the things that I've been through in my life, things that have caused trauma. And I'm speaking in regards to my military experience, because I do have insomnia. I don't sleep. And with lack of sleep, that causes the blood pressure to go up, because your body's never completely at rest. You need to sleep so that you're not moving around. But I have trained myself to rest, but even still, there's still an effect there. So just some more adjusting to do. And the day is March 27th. Yeah, so I am 2, 4, 6, 8, 10, 12, 14, 16. This is the 16th day out of the 30 days. I asked my doctor to give me to regulate my pressure, to implement some life changes to regulate my pressure. So I'm getting there. I got 14 days left, and 14 days come faster than what you think. So yeah, more adjusting, because I'm not doing no meds. I'm not going on any medications. That's a no. So all right, y'all have a blessed day.